Good evening and happy weekend, my friends. I'm Dr. J Mark, and I'm here to give you a little education on one of the diseases that most men are scared of. Once you see a man approaching the age of 40, 45, there is a common disease that makes them very uncomfortable, disturbs them as a man, and makes them not to concentrate in whatever they are doing. What is this disease? Prostate disease. Yes. And in the prostate disease, we have two common problems in the prostate. The first one is BPH, which we call the benign prostatic hyperplasia, and we have the prostate cancer. Now, there are certain risk factors that can expose you to having prostate diseases, especially the benign prostatic hyperplasia. This means enlargement of the prostate. You can take a look at the picture of the prostate. You can see the location that the prostate is just at the neck of the bladder. This is why people that have prostate issues, they present with a lot of urinary symptoms. So what are the risk factors to developing prostate diseases? Firstly, a lot of times it is genetic. That means if your father had prostate issue, you should expect it and you should do everything possible so it doesn't come. I will tell you some things you will do to prevent you from having prostate diseases. The other risk factors are obesity. Obesity is a very big challenge. People that are obese, they are at higher risk of developing prostate issues. People that live sedentary lifestyle. Sedentary in the sense that they don't move around, they don't play, they just sit down one place, they don't move their body, they don't exercise. These are the few risk factors that can expose you to prostate cancer. There are a lot of other ones, but these are the major ones. So if you are keeping fit, the other one that is very important that I need to tell guys, this is the reason why I can tell you categorically that a lot of our reverend fathers, they have prostate issues. Lack of ejaculation. If you are not ejaculating at least 21 times in a month, at least, you are at a very higher risk. So ejaculation reduces your risk of developing prostate issues. So this is the other one. When we were learning in school, we used to think it's not true, but it's been discovered from researches that it's actually true, and frequent ejaculation helps. I don't know how I want to ejaculate, but try to ejaculate. Researches have shown that it is very common in people who are getting older from 45 years up. But then there is something very particular about prostate diseases. There is a fluid in the prostate which follows sperm each time you ejaculate. This fluid is called the prostatic fluid. It normally contributes a small percentage of the sperm when someone ejaculates. So studies have shown that accumulation of this fluid contributes to prostatic enlargement and other prostatic diseases. So there is need for frequent release of this. Is very important. Now, let me go straight to some of the symptoms that when you start noticing them, you will begin to look for your doctor seriously because you might be having prostate issues. Part of these symptoms are the urinary symptoms. You know, when you are urinating, there is always a flow of the urine. If the urine is no longer flowing the way it's supposed to, you just bring out your blood clots to pee, you begin to pour on your leg. It's no longer having that projectile motion, then something is wrong. Then that's what we call low stream. Then we have what we call straining. You know, someone wants to urinate and you see them straining just for urine to come out. It means something is already strangling the neck of the bladder. You also see what we call hesitancy. A man will come to urinate and then they will stay for up to 1 minute and the urine is not coming out and they are feeling very pressed. You know, that's called hesitancy. They will stand and they will be begging the urine, please come out, and the urine is not coming out. After some time, the urine will come out. And even when it comes out, you see them straining for it to come out well and it's not coming out well. You see them trying, it can't even flow the way it used to flow. And then they have what we call incomplete bladder emptying. That means after the whole stress waiting for the urine to come out, they still feel like there are some urine remaining in their bladder. They're still feeling like they need to pee more. You understand? They need to urinate more, but then they can't urinate again. They have to wait. And you also have the urgency. Urgency is this kind of one that somebody will just feel pressed, and before they even get to the bathroom, the urine is already wetting their clothes. This is also part of symptoms of prostate diseases. You have nocturia. They urinate more frequently in the night. It's also a problem. It's also one of the symptoms that once you notice it, then you should know that the prostate is at risk. Then you have dribbling, which after urinating, you still have urine dropping, wetting their clothes, and they are done already. So these are the few symptoms that when you see these symptoms, you should be scared. Something is wrong. They also begin to have weak erection gradually. Their erection begin to reduce. It's a sign, all of a sudden approaching the age of 45, 50, you begin to have weak erection. Is a sign that the prostate is having some issues. And when it's prostate cancer, then you have other things like weight loss. They begin to lose weight, and they begin to have pain at the back pain. They begin to have pain at the back with a lot of other symptoms that they're going to present with. So these are the few things that when you see them, you should rush immediately to see your doctor. Now, I'm going to tell you a few things that will help you to keep your prostate safe as a young person who is getting old. Many young guys are 30, 35, and 40. Of course, they are still balling, they are still doing the things they are supposed to do. They don't have any problem. But once you cross the age of 45, in fact, it's more common after 50 years, then you have to really look out for your prostate. Regular ejaculation is very important. Remember what I said, at least 21 times in a month. That is optimum. Then you also need to stay very active as a man. You need to be exercising. You don't need to be told. No matter how busy you are, a lot of men just drive to the office, climb the staircase, or even walk to the office and sit down. When they are done, they enter their car back to their house. Obesity is one of the things that creates a lot of other problems in people's. We'll talk about the management of prostate diseases. There are a few things the doctor can do to manage the prostate. Firstly, you yourself, you need to help yourself. We need to do what we call lifestyle modification. So you need to improve on exercise. You need to increase your rate of ejaculation. I'm begging all the ladies, for the sake of prostate disease, please allow men to ejaculate. I have to be honest with you. Especially those within the age of 40 and above. Let them ejaculate. Please, it's very important. Then you also need to reduce the intake of caffeine and alcohol. Very important. All these things can worsen it, you understand? So when it comes to the treatment, we have some drugs that will be tailored to your own level and your own symptoms, which is not what I'm going to mention here, because you need to do some tests and some investigations so that you can know exactly the kind of drugs that they're going to take. Then we also have surgical methods, that what we call TURP, transurethral resection of the prostate. It is the gold standard. Total removal of the prostate, and then everybody will go and rest. Most men have had the surgery. Most times it doesn't affect your fertility, but then it helps you to at least regain your health, and once your prostate is no longer there, you won't have some of those symptoms. This makes a lot of men to walk around with catheters because they are having some of those symptoms I mentioned earlier, like frequent urination and the rest, and it can be very uncomfortable. For the cancer, prostate cancer is also very dangerous because it can spread from just the prostate to other surrounding places. When you notice that there is blood in your urine anytime, you need to move fast because it is a classical sign of prostate cancer. And they also used to have back pain because in prostate cancer, the first place it moves to is the bones, especially the vertebral bones. Then they have weight loss. So the management ranges from using hormonal therapies to also resetting the prostate entirely, especially if it has not been. It will be very difficult. So if there is anything you have learned today, the summary is, as a man, ejaculate frequently, exercise, avoid obesity by all means, reduce the intake of caffeine and alcohol, reduce smoking, and live an active lifestyle. Thank you and have a wonderful evening. I remain Dr. J. Mark. Share this video for all those that you feel it might